Okay, so we have already covered different aspects in pharmacokinetics. We have already discussed about absorption and distributions, and now we are heading to our third aspect of pharmacokinetics, that is metabolism. Now, what is metabolism? We already know that metabolism is a chemical alteration of drug in the body. It's a biotransformations, that means chemical alteration of drug in the body. Now, why do we need to metabolize drug? There are two things. Drugs is a chemical substance, and it is not good that drugs remains in a body for longer time apart from the action. So we need to make a way to somehow to make the drug go out of the body, and to go out of the body we need to convert the drug from lipid soluble to lipid insoluble. So in short, we need to convert the drug from non-polar to polar compounds. Okay. Most of these drugs gets excreted through the kidney, and kidney, the important unit is renal tubules. Yeah, so in those renal tubules, these drugs or some of the important particles again gets reabsorbed. So this reabsorption procedure involves lipid solubility. So if the drug is lipid soluble, it again gets reabsorbed into the body. So we need to convert the drug into lipid insoluble to get out of the body. And that is why metabolism is a process which converts the lipid soluble into lipid insoluble compounds. Where this metabolism occurs? Next question. The primary sites, we already seen first pass metabolism, that was before the main metabolism starts. But where is the main metabolism? Again, the main site of metabolism is liver, but there are some other places as well. Few drugs get metabolized in kidney, few in intestine, few in lungs, and certain drugs get metabolized in plasma as well, which are very shorter acting. So you need to remember the name of those drugs also, that can be asked in examinations, that which drugs metabolize in plasma. So metabolism leads to what? Again, the next question is metabolism leads to what? So most of the time metabolism leads the drug to make them inactive, but it's not the only thing, the role of metabolism. There is other role of metabolism as well. Few drugs are active, and because of metabolism they produces active metabolite, right? So there are some drugs are active, and through metabolism they produces active metabolite. And another aspect is few drugs are inactive as such, and due to metabolism it produces active metabolite. So metabolism involves in this both the procedures. So again, inactivation of drug is the main thing, but apart from that, this metabolism can produce active drug from active metabolite, or active metabolite from active drug, and it also activates the inactive drugs. So this scenario, and this scenario is called as prodrugs, and that is frequently asked in examinations. What do you understand by prodrugs? So prodrugs are few drugs which are inactive as such, and they need conversion into the active metabolites through the metabolism. So these drugs are called as prodrugs, while other drugs are, these drugs are active but their metabolite is also active. These drugs are as such inactive, but that metabolite is active. So these are some of the examples, like this is active drug with active metabolites, and this is prodrug, so as such inactive, and it produces active metabolite. So few of the examples you can remember, like morphine as such is also active, but it's also having its active metabolites, morphine 6 glucuronide. Allopurinol is also active, it produces alloxanthine. Diazepam is active, its active metabolite is also active, that is oxazepam. Digitoxin is active, it produces active metabolite digoxin. So you can remember few of them. While what are prodrugs? These are inactive drugs and produces active metabolite. Levodopa, it's not active, but it produces its action through its metabolite called as dopamine. Enalapril is not active, but it produces its active form, that is enalaprilat. So these are some of the examples you can remember, like acyclovir, an antiviral drug which gets into active form in the triphosphate state. So acyclovir triphosphate is an active form. So these are some of the examples you can remember, few of them for examination. Now this metabolic process, what it involves, there are different reaction of this metabolic process. Now in this figure, if you look carefully, these drugs, some of the drugs gets excreted without getting metabolite. Okay, so this is one way drugs gets out of the body without getting metabolized, while most of the drug undergoes the different metabolism. They undergoes metabolism through two type of reaction. One is phase 1 reaction and two is phase 2 reactions. So these drugs undergoes phase 1 reactions and get excreted. Some drugs undergo phase 2 reaction, gets excreted. But there are also some drugs which undergo both the phases of reaction. They undergo phase 1 as well and also phase 2 and then gets excreted. Okay. So depending upon the characteristic of a drug, different reactions are there to make them inactive, and then again it goes under the excretion process. But mainly if you divide, there is phase 1 reactions and phase 2 reactions. Phase 1 reactions are called as non-synthetic, while phase 2 are called as synthetic. Phase 1 reactions are also called as functionalization reactions, while phase 2 reactions are also called as conjugation reactions. Now let's see what are different phase 1 reactions or non-synthetic or the functionalization reactions. These are simple reactions: oxidation, reduction, hydrolysis, cyclization, decyclization. See, so all these reactions are simple. These are called as phase 1 reactions. We'll briefly discuss about oxidations because that is the most important of all the reactions. Oxidation is most important of all these reactions. So we'll talk about oxidation. So in what happens in oxidation, there is addition of oxygen. Why it is most important reactions? Because it is been carried out by group of enzymes that are called as monooxygenases. So monooxygenases are the enzymes which are present in the liver, and with the help of addition of oxygen, this oxidation process is been carried out. Now these monooxygenases have more than 100 cytochrome P450 isoenzymes. Okay, so this monooxygenases also involves different isoenzymes, and most important isoenzymes are CYP isoenzymes. So this oxidation reactions is carried out by CYP isoenzymes, and CYP family has subfamily, and depending upon that the different names been given, like CYP 3A4, 3A5, 2D6, 2C9, 2C19. There are many, but these are some important ones. But 3A4 is the most important. 3A4 is the most important. So cytochrome P450 isoenzymes, these are cytochrome enzymes. It has been written as a short form CYP, and then its family and subfamily, that is 3A4, 3A5, depending on that. There are also other monooxygenases like flavin monooxygenases that also carried out this oxidation process. But important oxidation reaction which has been carried out by cytochrome P450 isoenzymes and their families. So that was important phase 1 reactions. Let's jump to phase 2 reactions. What happens in phase 2 reactions? We already know that it's a complex reactions. So it involves addition of other things as well. And depending upon that, the name is been given: glucuronide conjugation, acetylation. We don't need to go into much detail about the biochemistry of those reactions, but we just need to remember which drugs get metabolized through which reaction. Like glucuronide conjugation is the most important reactions, and most of the drug undergoes these glucuronide conjugations. But short questions can be asked from these acetylation reactions. Which drugs undergo the acetylations? And you can remember as sheep. S for sulfonamide, H for hydralazine, I for isoniazide, and P for PAS, that is being used in tuberculosis. Okay, so drugs undergoes acetylations are sulfonamide, hydralazine, isoniazide, and PAS, and these drugs can produce adverse drug reactions related to autoimmune reactions. So autoimmune reactions are associated with acetylations metabolized drug. Some amines undergo methylations like adrenaline and histamine. These are amines that undergo methylations. Hormones like adrenal and sex steroids undergo sulfate conjugations, glycine conjugations. Important thing, paracetamol. Paracetamol goes under glutathione conjugations. And some drugs are also having its synthetic reactions like ribonucleotide and nucleotide synthesis that is associated with anti-cancer drugs. So different drugs getting metabolized through different reactions. Initially we saw the phase 1 reactions that were simple reactions and oxidation was most important, and now we've been seeing synthetic reactions, some complex reactions, and these are some of the examples of drugs which undergoes synthetic reactions. So all in all, the metabolic process is being carried out by two type of enzymes. One is microsomal enzymes and one is non-microsomal enzymes. Where are microsomal enzymes are situated? Microsomal enzymes are located on smooth endoplasmic reticulum. Okay, mostly of liver, but also present in intestinal mucosa, lung, and kidney. They are present in smooth endoplasmic reticulum, microsomal enzymes, and most of the reactions are carried out by them. While some of the metabolism are carried by non-microsomal enzymes, which are present in cytoplasm and the mitochondria of hepatic cells. So microsomal enzymes are present on smooth endoplasmic reticulum, while non-microsomal enzymes which are present in cytoplasm and mitochondria of hepatic cells. Microsomal enzymes, best example monooxygenase, most of the drug gets metabolized, cytochrome P450. Okay, these are important microsomal enzymes. Why esterases, amidases, flavoprotein oxidases, these are non-microsomal enzymes. Which reactions are carried out by microsomal enzymes? Most of oxidations, reductions, hydrolysis, and one of the complex reactions, that is glucuronide conjugation. Only complex reaction carried out by microsomal enzymes are glucuronide conjugations. Apart from that, all other reactions are carried out by non-microsomal enzymes. So these are the difference between microsomal enzymes and non-microsomal enzymes. Where microsomal enzymes present, where non-microsomal presents, which enzymes are microsomal, and what reactions are carried out by each enzyme. So on the three aspect, the difference is made basically. Now one more important thing that can be asked in examination as a short question is, what is Hofman elimination? An important, a very peculiar and a characteristic feature. Hofman eliminations. You know, there are some drugs, like for an example atracurium. This is one of the drug that is being used in anesthesia as a muscle relaxant. So what is the way of metabolism? We have already seen most of the drug get metabolized in liver, most of the drug get metabolized in kidney, gut mucosa, you know, even in plasma. But what happens here? Inactivation of drug in the body fluids by, this is important thing, spontaneous molecular rearrangement without the use of any enzymes. You know, so see, peculiar thing here, no enzymes gets involved. Inactivation occurs in the body. How? By spontaneous molecular rearrangement. So the molecule of drug gets rearranged automatically and the drug gets inactive by itself. This is a very peculiar and a unique way of making drugs inactive, and that happens with some of the drugs, and examples are atracuria. Now, what is the clinical importance? What it its clinical implications? Clinical importance. What is the clinical importance of this kind of? The clinical importance is if a patient is having liver problem. Can you give drugs which are getting metabolized through liver? No, because the liver is already having a problem. Liver won't be able to metabolize those drugs, and these drugs will accumulate in the body and it can produce toxicities. Can you give some of the drug which get metabolized through kidney? What if the kidney is also damaged or kidney is not functioning properly and we are giving drug which gets metabolized or excreted through the kidney? Though those drugs again gets accumulated in the body and produces toxic effects. But what in both this condition, if a patient is having liver damage, if a patient is having kidney damage and or kidney damage, can we give this kind of drugs? Yes, because there is no role of liver, there is no role of kidney, the drug gets inactive by itself, spontaneous molecular rearrangement. So the clinical importance is you can give this kind of drug in patients with liver and kidney problems. So it's none of this related to metabolism. So that is why in that kind of thing, so these are very comparatively safer drugs and you can use them in patients with comorbid conditions, especially of liver and kidney.